Hello everyone, here we have a patient with us who has come from quite far, almost the east of the country, and his complaint is very apparent. He is not very fond of the growth which we see on the right side of his chin. He showed us pictures which was say about 2 years back, and the skin happened to be all uniform. It was at one continuous plane, but he happens to have this growth since the past 4 years, 5 years almost. ये जो आपको सूजन सा है, ये जो स्कार था वो बढ़ता गया, ये सर्जरी के बाद वैसा होता गया, राइट? तो उसको कितने साल हो गए अभी? 1.5 साल हुआ है. ओके. He had an incident of an RTA, which is a road traffic accident, a two-wheeler accident basically, which caused a lot of maxillofacial fractures. So the maxillofacial fractures are the bony fractures. He had a fracture, the symphysis, which is at the chin. He had fractures which his teeth were avulsed. It means his teeth broke and came off, which were the upper teeth, and also he had an impact on his right TMJ joint. All these were corrected, and there was a laceration along the lip. So अगर आप थोड़ा सा मुंह खोलोगे, and if you look up, we can see that this area had got bruised and lacerated, and even the lower lip was bruised and lacerated. So it was a loss of skin, as we say, or loss of tissue, as we say. And because of this tissue loss, in order to repair that, he underwent a secondary surgery. Now this secondary surgery where a full thickness skin graft, that is a skin which has been harvested or tissue harvested from other part of the body, was placed here. And I would also like you to show as to from where the skin was taken. If you can just turn a little bit towards. So we see this is exactly the area where the free skin, full thickness skin graft was taken, which is the posterior auricular area or behind his right ear. And we see he has an elevation or a growth. That is because his skin has keloid tendency formation. So even at the surgical site, we see that he has a scar or a growth, which is a keloid. At this region he has keloid formation, and also we would like to show that he got an injury because of his bike traffic accident. If you can show your left arm, sir. This was a minor injury, almost an abrasion at the time of accident, but as we see the growth now, it's a keloid growth. That is because his skin has this tendency. He took a lot of intralesional injections and even some therapy with silicone sheet. As he said in his words, it did give him some respite, but that was very temporary and transient. So he wants a permanent solution for this growth, which is a keloid. And also his complaint also remains as the scanty beard in this region. As of now, the plan is for keloid removal and long-term follow-up. Also implant removal because of the fractures. The implants, which is the plate and the screws which were fixed at that point in time, has not been removed, and he wants and the patient desires that to be removed. So yes, it will be work on the keloid, and it will be implant removal for him by Dr. Richardson. We'll follow it up inside the theatre as well. Thank you.
Keloid that's sitting on the lower lip and chin, as you can see, we're planning to do excision and some amount of reconstruction. He also has a scar there which we would revise. He's already had a couple of surgeries for the same elsewhere in the east of this country. Okay, we'll have to maybe. That was the skin graft that was used earlier, which we have repositioned, and that's what you're seeing now. It was before. So you can see this. That was a pretty large lesion, extending about 30-40% of the chin, and also involving the lip. So this is the immediate result. That's the two same view. Do you have another view, please? View. Okay. Next is good. opened up, is it? Just leave it, it's not straight. Leave it. Nothing to be done, just leave it. Leave it open, apply mupirocin. That's it. It will take time. He has to just send him out. Peptide can come. And apply mupirocin outside. It should settle out. It should.